Imagine you break your leg on a Tuesday. In one country, you're bankrupt by Thursday. In another, you will never even see a bill. In a third, and this one's going to sound made up, I am going to say it anyway, the government literally pays you cash rewards and vouchers just for staying active. Hit your step count. Get paid. No catch. Same injury. Same bone. Wildly different outcomes. Weirdly, none of these countries thinks their own system is an outlier. They all think it's normal, and everyone else is doing it wrong. By the end of this video, you will know exactly why, and it's not the reason you think. Number 8. The United States. You'd expect the richest country in the world to have the best healthcare on the planet. Instead, it has some of the worst outcomes of any wealthy nation, and pays double what everyone else does to get there. The mechanism here is the employer-sponsored insurance system, patched together with Medicare for seniors and Medicaid for low-income Americans, and a whole lot of nothing in between for everyone else. Here's the scale of it. America spends close to 18% of its entire economic output on healthcare. A single ambulance ride can run over $1,000 before you've even reached a hospital bed. A routine MRI scan can cost anywhere from around $500 in one state to several $1,000s in another. Same machine, same scan, wildly different price tag depending on which hospital you happen to walk into. An estimated 100 million Americans are carrying medical debt right now, not from catastrophic illness, just from normal healthcare. Supporters argue that the system rewards innovation. Most of the world's new drugs and treatments are developed with American capital chasing American profits, and that patients face effectively no wait times for specialists compared to almost anywhere else on this list. Critics point to the simple fact that Americans die younger and sicker than people in countries spending half as much. And that's the paradox that opens this whole video. More money, worse results. Keep that thread, it's going to come back. Number 7. The United Kingdom. 1.5 million employees. That's not a typo. That's the headcount of a single healthcare system, making it one of the largest employers on the entire planet. The infrastructure is the National Health Service, NHS, funded entirely through taxation, free at the point of care. No bill ever for almost anything. It was built in 1948, out of the rubble of a war-torn country, on the radical idea that getting sick shouldn't also mean going broke. A system that's been running, fully intact, for over 75 years. And here's where it gets almost hard to believe. That employer is up there with the US Department of Defense and Walmart in raw headcount, and it treats over 1 million patients every 36 hours. Supporters argue that removing cost from the decision entirely means nobody ever avoids a doctor because they're scared of the bill. Critics point to the waiting lists. Some patients waiting over a year for non-emergency procedures, because when something's free, demand doesn't really have a ceiling. There, healthcare is a birthright, not a purchase. But free isn't the same as fast, and that trade-off shows up again and again in this list. Number 6. Germany. Everyone assumes universal healthcare means one government-run system, full stop. Germany blows that assumption away. It runs over 100 competing non-profit insurance funds and somehow makes universal coverage and market competition work in the same sentence. The framework is called the sickness fund system, a statutory health insurance funded by payroll contributions split between employer and employee, but delivered through a competitive marketplace of insurers. Here's the scale proof. This system has been running in some form since 1883, making it the oldest universal healthcare system in the world, older than the light bulb common in most households. Germans can walk into almost any doctor's office same day, no referral required for most specialists, and can switch insurers almost as easily as switching a phone plan. No medical underwriting, no denial for a pre-existing condition. Supporters argue that competition between insurers keeps quality high, without sacrificing universal access. Critics point to the fragmentation. Over 100 funds mean enormous administrative overhead compared to a single-payer model. Germany basically asked, what if capitalism and universal care weren't actually enemies? And a century and a half later, nobody's proven them wrong. Number 5. Japan. Picture a country where the average person sees a doctor 13 times a year. Yes, you heard that right. That's Japan, and it also happens to have the oldest population on Earth and the longest life expectancy of any major nation. Those two facts are not a coincidence. The secret, universal insurance, tightly regulated pricing, set by the government. Every hospital, every clinic, charges the same price for the same procedure, nationwide. And unlike a lot of systems on this list, nobody needs prior approval or a referral to see a specialist. You just show up. And it barely touches anyone's wallet because the government caps prices so aggressively that the frequency of visits would bankrupt a family almost anywhere else on this list. Government-set pricing keeps costs shockingly low system-wide. The catch? That same aging population is straining the system's long-term finances, and rural areas increasingly struggle with doctor shortages as the workforce ages along with everyone else. We're halfway through the video. If you're enjoying what you've seen so far, please take a moment to like and subscribe. It helps more people discover our work and supports us in creating more videos like this. A great deal of time and research goes into every episode, and we'd truly appreciate your support. Now let's get back to our list. Number 4, Singapore. On paper, this system shouldn't work. Universal healthcare, where the government doesn't pay for most of it, where you pay out of a mandatory personal savings account, and yet Singapore still ranks near the top of every global health index. The strategy is called Medisave, a compulsory savings scheme where a slice of every paycheck goes into a personal medical account, plus a catastrophic insurance layer called Medishield for the big stuff. If your Medisave account runs dry, Medishield kicks in specifically for the big, catastrophic events, hospital stays, surgeries, the bills that could otherwise wipe out a family's savings in one shot. The scale proof. Singapore spends roughly a third of what the US spends per capita on healthcare, and yet consistently outperforms it on life expectancy and outcomes. It's one of the cheapest, expensive healthcare systems in the developed world. Supporters argue that forcing people to see their own healthcare spending curbs waste. You think twice about an unnecessary test when it's coming out of your own account. Critics point to the risk that this could shift undertreatment onto lower earners. If a checkup or a prescription comes straight out of your own limited savings, some people put it off, meaning the same design that curbs waste for the wealthy can also discourage the poor from seeking care they actually need. It's healthcare that runs on personal responsibility with a safety net underneath, the opposite instinct of nearly every other country on this list. Number 3, Canada. Here's a common mix-up. People assume Canada's single-payer system is basically a copy of the UK's. It's not even close. Provinces run their own systems and the federal government just sets the rules and writes checks. The vehicle is Medicare, not the US version, the Canadian one. A single publicly funded insurance plan per province, covering hospital and doctor visits, but not dental or prescription drugs for most adults. Scale proof. Canada has universal coverage for medically necessary care, but wait times for specialist referrals can stretch to months, and there's essentially no private option to jump the queue for covered services. It's illegal in most provinces to pay to skip the public line. Cross the border into the US for the same procedure without a wait, and it could cost tens of thousands of dollars out of pocket, which is exactly why some Canadians do when they can afford it. Supporters argue that it strips the profit motive entirely out of essential care decisions. Critics point to the wait times as the direct cost of that choice. You can't buy your way to the front. Canada picked equity over speed, on purpose, as policy. Whether or not that's the right trade is basically the argument at the heart of it. Number 2, France. The World Health Organization once ranked one country's healthcare system the best on earth. Full stop. Out of every nation it studied. That was back in the year 2000. That country is France, and the generosity that got it there looks on the surface like it should be a budgetary disaster. France uses a hybrid system, a mandatory public insurance covering the bulk of costs, topped up by near-universal supplemental private insurance that covers almost everything else, so patients rarely pay much out of pocket. The scale proof. French patients have full freedom to choose any doctor or specialist without a referral or gatekeeper. And the country maintains one of the highest doctor-to-patient ratios in Europe. Doctors here still make house calls more than almost anywhere else in the developed world, and a walk-in visit to a general practitioner routinely costs less than a decent lunch. Supporters point to that WHO ranking as validation of the hybrid model, even though it dates back to a single assessment from 2000 and the WHO hasn't repeated a full country ranking since, so it's more a historical badge than a current scoreboard. Critics point out that the system runs persistent deficits, financed by rolling over government debt year after year, with no clear plan to close the gap. France basically built a system optimized for patient experience first and worried about the bill later, which is either visionary or a ticking clock, depending on who you ask. Drumroll, number 1. Single digits to somewhere around 85 to 90%, depending on which survey you check. That's how far health insurance coverage climbed in Rwanda in about 2 decades. A country rebuilding from genocide, with a fraction of the wealth of every other nation on this list, building one of the most successful community health insurance programs in the developing world. The innovation is Mutuelle de Santé, community-based health insurance, with premiums scaled to income, sometimes just a few dollars a year for the poorest households. Pooling risk at the village level. Community health workers, trained locals, not doctors, handle a huge share of basic care in villages, which is part of why the whole system runs on such a shoestring budget. That 2-decade climb, one of the fastest coverage expansions in modern history, came alongside a dramatic drop in child mortality over the same stretch. Supporters argue that Rwanda's system is that proof universal coverage doesn't require a rich country's budget, just political will and smart design. Critics point to a real fragility. The system leans heavily on foreign aid and donor funding, and quality still lags far behind the wealthier countries on this list. Rwanda is the reminder that universal isn't a luxury reserved for GDP giants. It's a design choice, available at basically any income level. So that's the tour: the US, the UK, Germany, Japan, Singapore, Canada, France, and Rwanda. 8 completely different philosophies. Public versus private, mandatory savings versus mandatory taxes, one payer versus 100 competing funds. Notice Singapore and Canada landed on almost opposite instincts: pay your own way versus the government pays for everything. And yet neither one nails outcomes without that same primary care backbone underneath. And here's the thing that took me way too long to actually notice, going through all this research. It's not public versus private. It's not even about the money. The US proves that outright, spending more than anyone and still losing on outcomes to countries spending half as much. The variable that keeps showing up underneath every single one of these systems is how strong and continuous their primary care layer is. Remember Germany's same-day no referral doctor visits or Japan's 13 visits a year culture? Those aren't side details. They're arguably the actual reason those countries post such strong outcomes. The countries where you have one doctor who actually knows you, who you see regularly, who catches problems early, those are the countries with the best outcomes, almost regardless of whether the money comes from taxes, savings accounts, or a village pool in Rwanda. The US has world-class specialists and hospitals, but a comparatively thin, fragmented primary care layer, and that's arguably the real reason all that spending doesn't translate into results. So maybe the real question isn't public or private, it's, does this system make sure everyone has somewhere to go before they're sick? So, knowing all of this, which of these 8 would you actually want to live under? Drop your pick in the comments and tell me why. Leave whatever system you're curious about in the comments, and it might be the next video. Until next time on Comparison Explained.